We are very privileged to have with us Dr. Prathiba Varkey, who has had a brilliant career already with several chapters yet to be written, and now has just recently been appointed CEO of Mayo Clinic Health System. Dr. Varkey, thank you very much for being with us, and wanted to just have a conversation with you about the Vellore education and the Vellore value system with you. So let me begin by asking, you've had a brilliant career at some of the best institutions, healthcare institutions in the world. How has the education from Vellore helped you in your career?
George, let me begin by saying thank you for inviting me. This is truly an honor. And I'm really privileged to be part of this dialogue. Vellore and my experiences in CMC really, I think, created the core of me as a person, as a leader, as a physician. And I think I really learned a lot from the role modeling that I observed from a large number of the faculty at CMC and also my fellow students and seniors at CMC. The dedication, the hard work, the rounds at 2 a.m. when everyone was as involved as 10 a.m. rounds, the unrelenting pursuit of excellence and core belief in making the community better and advancing science and also the science of education, medical education, and advancing research with a very mission-oriented approach truly has inspired me and has continued to be a part of who I am and hopefully what I'm bringing to the communities I have been privileged to serve.
Well, that's wonderful. In fact, you mentioned a couple of things, so I wanted to dive into that a little bit more. As you know, Vellore has an unusual value system, and in being, you use the word excellence. I think that's the right way to look at it. Excellence in clinical work, excellence in research, at the same time serving the rich and the poor. It's really a holistic value system that is truly unusual. As you look back at that and as you've seen other institutions, are there lessons and parallels that from there that could be used for healthcare in other parts of the world?
I think it's really, CMC is so forward-thinking and it's truly ahead of its time. And a lot of things that I learned, not just about medical care and medical education, as I said, but even about innovation that's become a huge part of my career, really started at CMC. Because it's really, in CMC, it was thinking about how do we use the scarce resources that we have to enhance the health of the communities that we served around Vellore. And so translating that to how do we impact the healthcare of communities with the resources that we have in communities in the US. So lots of parallels that way. The pursuit of excellence, the pursuit of innovation, the interest to advance the science of healthcare and medical education while we are serving the poor and all parts of the community. Those are also traditionally core parts of amazing, inspiring institutions that I've been fortunate to be part of, including Mayo Clinic. So I see lots of parallels there. And as I've said, it's truly been a privilege to learn from people who have role modeled these skills and ways of thinking. And it's truly influenced my career.
Your career has gone through various changes. You played very different roles. You obviously a doctor. You've gotten involved in the community health systems. Um, when you look at the aspect of public health that you've been involved in, how how did you decide on that? And anything about Velour that influenced you in that choice?
My most memorable parts of medical school were being in the villages in Kanyambadi district uh, as part of my rotations in community health and preventive medicine. And I was very inspired by my teachers who were their chairs of the department at that time, Dr. Abraham Joseph, and then subsequently Dr. Salochana Abraham, who I've continued to keep in touch with. But the remarkable improvement and impact that they've had on the community surrounding Vellore was something that truly inspired me. And the ability to think beyond traditional medicine and taking care of one-on-one, taking one-on-one care of patients, which I truly am grateful for as a physician, but actually impacting large numbers of people through interventions in public health and community health really, really inspired me. And that journey began in CMC. Subsequently, I followed that with the Masters of Public Health at Harvard School of Public Health, and then a preventive medicine fellowship at Mayo Clinic. But really, the roots began at CMC, and the idea was how can you make maximal impact on the people that you serve through the interventions that you're privileged to provide during your career.
Velour, as you know, is a very resilient institution. It's now over 100 years old and has evolved with India, but at the same time retained its core pretty much without any change. The value system has remained through all these changes. Has the healthcare system in India has changed, the for-profit hospitals and all of the other things. What drives Velour, or what allows Velour to retain the core in a fast-changing world and fast-changing India?
Well, I think personally, it's undoubtedly the people. So it's the faculty, it's the students, it's the teams, it's the staff, everybody that serves as part of the vision of CMC and Velour that keeps the culture going. And the storytelling about the Ida Scudder days and how she came into the village, and really felt the calling to serve the community and introduce medical education first for women and then, to the larger community. All of those stories that are passed down really, I think, contribute to keeping the culture and the mission alive. But at the end of the day, it is really the people, everybody, starting from the dean, the principal, the physicians, the nurses, and all the staff and students that keep the culture alive.
Part of your career also has gone into teaching and into institutions that focus on teaching and instruction. As you know, Velour combines clinical and the teaching part and doing both excellently. What drives you into the teaching part of it?
My grandparents, both maternal and paternal, were teachers. A large part of my uncles and aunts from my paternal side are teachers. Both my parents were medical educators and professors of medical schools in Kerala. So I think really teaching runs in my blood. And if you strip everything away at the core, I'm actually an educator. And the thing that personally deeply brings me the greatest happiness and joy is inspiring people to be the best they can be.
You mentioned a few minutes ago about how Velour has helped you, not just as a clinician and as a medical professional, but as a human being. Can you elaborate on that last piece of it a little bit, please?
I think you mentioned it, George, the resiliency aspect. In really understanding, that life is a journey, and you make use of the resources that you have in front of you. You partner with your colleagues and friends, to do good things for your community. And as you do that, you naturally become a better person while doing that. And you also learn a lot from the people you serve. So it's all of that. It's truly been a pleasure to keep in touch with the faculty and several of my classmates and colleagues in continuing that journey in being a better person and a better leader and a better physician.
Well, Dr. Varkey, thank you very much for your time today, and wish you the best as you start your new job. So thank you again.
Thank you for having me, Joe.